really remember Mom very fondly. And, what I remember most about her was her love of family. Family was everything to her, but she also, lived a very active life right up to her 90s. I remember how much she loved gardening. Right in the summer, she spent every day, almost all summer long, out at the garden. And I remember you, Dad. She would drag you out there too,
Yeah.
right, pulling weeds, and but she also was a very talented artist, and was really well known in this area for her artwork.
I just remember my mom was a wonderful, wonderful woman. She was just amazing. That's all there is to it. She taught us so much. She loved her family so much, and her children, her grandchildren, and her husband, and all of it. She was just amazing.
Got along with her for 68 years, so she must be quite old. And her paintings, I don't know how many she's done. It's in the hundreds. She's got them all over. You know what I mean? She's even got one in Italy. Yeah, she's really talented.
My mother, she was really very healthy, very active, right up until about the age of 89, 90, and she developed some valvular heart disease, and which, because of that, she kept having to come to the hospital when she had exacerbations. She really hated it when she had to come. It was a difficult time for her. And at one point, even a couple times, our cardiologist mentioned, you know, um, we can't fix your heart, and this is going to keep happening. And do you want to continue coming to the hospital when you have a worsening of your symptoms with heart failure, or would you like to stay at home? And of course, my mom's answer was, I'd like to stay at home. And he said, well, then we can keep you home with hospice. And initially, my mother thought that hospice was at the really last week or very end of life. But she agreed to, and my dad agreed to, let hospice come and talk to them. And what they found out was that hospice was available, to help her stay at home and keep her out of the hospital, and they could manage some of her symptoms when she, had some worsening symptoms of, difficulty breathing, legs swelling, and they actually were able to come to the house, and give her some IV medications that brought her back out of that. And they were able to keep her, we were able to keep her at home, with hospice care for over a year, which there's no way that could have happened without hospice care.
Oh yeah, it's like that. I thought, you know what I mean, it was the last few days is what they done, but they done it for better than a year, and they did a wonderful job.
With Priscilla, we were there for spiritual, our volunteers, our aides, and our nursing. We all had a part in her life, which enhanced what she had left.
Yeah, I think she had a better quality of life with hospice helping her.
Absolutely, absolutely. My mom, she was a very social person, and she just loved having someone come every week to spend time with her, even though she was with my dad. My dad really was her primary caregiver. Penny and I and our other siblings, our brothers, were right there. We all were kind of helping, but Dad was the primary caregiver. But it was a huge help, and for hospice to be able to come in and help with some of the, with the medications. They did our medication, her pill box. They did her wound, took care of her wounds, and just really was someone that she looked forward to every week for them to come and help her and spend some time with her. When she needed some increase in her medication to keep her comfortable, we did have to call, and it was quite late at night. It was definitely off hours, and they were right there, answered the questions, told us exactly what we needed to do to help keep her comfortable during her last days.
Absolutely did. Oh my goodness, they were amazing. She loved them all. They were always so kind, and they were just wonderful. Their mom she loved to have them come. So she definitely bonded with the nurses.
Yeah, it was a little tough the last, when they had to come at the last day. It was hard on them, because they had grown very fond of my mother, and she had grown very fond of them. So it was a tough day.
They're a part of our family, so they're a member, and our hearts are always into what their needs are as far as their comfort, their symptom management. And again, we work together as a team, and with the families as well. Not just us, it's the families, the doctors if we need to, anybody that is in their life that is appropriate, to help get through things. So with the spiritual, we do for 13 months following the patient's death, we follow with them for emotional support, bereavement. We have meetings and classes and books, magazines that they get monthly if they choose to do it. So it just doesn't just end with the death of the patient. We continually work with the family for at least 13 months afterwards, and that makes them part of our family and us a part of their family. So the bond there is almost a forever bond.
In my experience, and I'm a medical professional, so I see a lot of these patients, and unfortunately, too many wait until the last week. So much hospice can offer to them, and to keep the patient home through till the end, which my mom was, instead of having to go to some kind, to the hospital, and there's just so much they can offer, and I don't think people realize that they think it's end of life. When I mean end of life, I mean end of life last week, last few days, that you sign up for hospice. I see it time and time again. And fortunately, I guess the cardiologist was astute enough to say, what, Priscilla, maybe this might be an option for you.
It was absolutely the most beautiful family to work with. They were working together. We worked together with them to make sure her comforts were met, her needs were met, her life enjoyments were met. Our volunteer went in and read the books that Priscilla couldn't read, and that was just amazing. For such an amazing woman, it was such a pleasure by all of us to take care of somebody that was so important to her own family, and that they allowed us to be a part of their family.
So I want to thank all the hospice workers that come is real nice, and I advise it for anybody.
Thank you, all of the wonderful hospice nurses and aides who was there with my mom for the last year. She adored you, and I know you adored her as well. So thank you from the bottom of my heart.
And I just want to say thank you from the bottom of my heart, too. Thank you very much for all you did.